Joining us now is David Mansdorfer, former Deputy Assistant Secretary for Health. David, welcome to the program. On this program, we're very much behind Bobby Kennedy becoming HHS Secretary. David, make the case as to why you believe Bobby Kennedy should be installed as such.
I think that Bobby Kennedy has the chance to challenge all of the preconceived notions around public health. As we've seen during COVID and coming beyond COVID, that we just saw such a draconian use of public health in the United States. And with this nomination, which really brings together a unique movement around health in America, we're really at a flashpoint to make sure that we can push evidence-based practices and not be censored around topics that we have traditionally been not able to talk about. And RFK brings all of those to the table. RFK brings every opportunity to disrupt a public health industry and a money industry that is in desperate need of reform.
Yeah, and so I think the core issue here is Bobby Kennedy has been a lifelong public health advocate. He's been a lifelong advocate for moms and against environmental toxins. What is it especially, who is against him most forcefully and why?
Well, I think the pharmaceutical companies to start, as you've seen with Vice President Pence's kind of fake outrage campaign, which is being funded by pharma. You have a lot of money in healthcare, and you have a lot of money in special interest groups that are deeply embedded in the U.S. Department of Health and Human Services that do not want to see their money troughs being taken away from each other. And so I think you're going to see the activist association groups come out heavily against him, like the American Medical Association. You're going to see pharma come out against him. And you're going to see a lot of the big money players that don't want people to know where the money is, and they're going to feed it through groups and organizations like Mike Pence's group that is coming out and creating all of this fake outrage.
Yeah, I mean, look, a healthy population is the kiss of death for big pharma. Talk about how if we actually get to root causes, if we get down to the root issue, then we don't need Ozempic for obesity for kids. We don't need these other interventions down the road.
Yeah, I think one of the first things that a Secretary Kennedy, if confirmed, will look at is the things like the dietary guidelines, which go deeply into how we have do school lunch programs here in the United States, which is a big indicator of health. As we've seen, there is an obesity crisis in the United States. There is a military readiness crisis because the lack of folks that can enter the military based on physical fitness. And I think a Secretary Kennedy and the incoming Trump administration will do wonders for chronic disease and prevention, where historically it's wholly underfunded. Typically, we only fund the disease at the end when you're having to deal with it, not when we are trying to prevent it to begin with.
So the chances of his nomination hinge on a couple of Republican senators who I don't think they've really experienced the energy of Maha before. Let's go through some of Bobby Kennedy's opening remarks here. I think they're really dramatic. Play cut 133.
My journey into the issue of health began with my career as an environmental attorney, working with hunters and fishermen and mothers in a small town in the Hudson Valley and along the Hudson River. I learned very early on that human health and environmental injuries are intertwined. The same chemicals that kill fish make people sick.
Let's continue to cut 134.
Today, Americans' overall health is in grievous condition. Over 70% of adults and a third of children are overweight or obese. Diabetes is 10 times more prevalent than it was during the 1960s. Cancer among young people is rising by 1 or 2% a year. Autoimmune diseases, neurodevelopmental disorders, Alzheimer's, asthma, ADHD. Depression, addiction, and a host of other physical and mental health conditions are all on the rise, some of them exponentially.
And finally, let's go to this one here, play cut 135.
The United States has worse health than any other developed nation, yet we spend more on healthcare, at least double, and in some cases triple, as other countries. Last year, we spent $4.8 trillion, not counting the indirect costs of missed work.
What is your reaction to this the opening statement of Bobby Kennedy, the idea of environmental toxins and how they are polluting both the planet and not just the planet, but the conditions of the people of America?
Well, what's interesting is that he's speaking directly to Democrats with that conversation. And public health, those are topics considered under social determinants of health, which are long held, parts of the Democratic platform around public health. And so I would think those types of conversations are basically a reach across the aisle that says, hey, we've worked together on issues like this before, and they've not traditionally been some of the Republican issues in how we've approached public health. So with that, why are you against me now when you've been working with me on all of these topics before? I think it's a reach across the aisle, but it's also to point out the disingenuous nature of this hearing, which will turn into multiple attacks on a variety of public health issues, when I think in many ways RFK is probably the best secretary that the Democrats could ever hope for.
Let's close here by playing cut 136. 136, please.
For a long time, the nation has been locked in a divisive healthcare debate about who pays. Well, when healthcare costs reach 20%, there are no good options, only bad ones. Shifting the burden around between government and corporations and insurers and providers and families is like rearranging deck chairs on the Titanic. Our country will sink beneath a sea of desperation and debt if we don't change the course and ask, why are healthcare costs so high in the first place?
Closing thoughts, David.
I think the most powerful thing that RFK has said in his opening is healthy people have 1,000 dreams, sick people have one.